Melissa, would you please help me get folks in, admit folks into the room? I think we're good to start admitting folks. I'm going to send this email to Anaya real quick. Is there anybody else that needed to be sent the Zoom link?
No, that's all I got.
Okay.
I just needed, Jennifer Silva to
Okay.
be promoted, and then Anaya Hall the link to the meeting. Thank you.
That sounds great.
Thanks, Tasha.
Thank you, Raquel.
You are so great at keeping up with all the details. I appreciate that talent that you have.
It's the
We
least
are
I can
all
do.
blessed by that mind of yours. Thank you.
Thank you.
Okay. Sent.
Let me know when you're ready, Judith.
I am ready to go.
Okay.
Thank you.
Council will call our meeting to order. Roll call review meeting packet. Tasha, are you doing roll call today?
Yes,
Okay, go ahead, Tasha, you're up.
All right, let me just pull it up right quick. I'm on my phone. Give me 1 second. Sorry.
Okay.
Here we go. All right. Good morning, members, and welcome. I'm gonna start off with roll call. Danielle Ungadi.
Present.
Thank you. Dr. Rob Archuleta.
What up?
What up? Preston Berry. Whitney Butcher.
Present.
Good morning. Raquel Garcia.
Present.
Carolyn Hall.
Present.
Tasha Conkers present. Judge Elizabeth Leith.
We don't come over here. Oh, shit.
Maria Martinez. Maria.
Maria Martinez has said something in the chat. Hold on.
Thank you, Raquel.
Oh, no, that was Nagel, myself.
Okay.
Wrong person.
Maria Nagel.
I see her now. I'm going to let her in one moment. Okay.
Okay.
I think she did. Thank you.
Keith Parker. Kari.
Here.
Thank you, Keith. Kari Parchinsky. Sorry if I butchered that. Antonio Pito.
Carrie's in the waiting room. I'm going to let
Alive
them
and
in.
present.
Thank you. Jennifer Silva. Catherine Washington.
Good morning, present.
Good morning. And Anaya Hall.
I just sent her the link, so it might take her a minute.
Okay.
Tasha, would you please call Maria and Carrie again? I just let them in.
Kari Parchinsky. Parchinsky.
Yes.
Did I pronounce that correct?
Yes. Yes, you did. Thank
Awesome.
you. Carrie
Thank
Paczynski.
you. And Maria Martinez.
Maria Nagel is here.
Okay. Maria Nagel.
Present.
Thank you. Welcome, guys. And Raquel, I think that is all, so I will send it over to you.
This is such a cool day. For those of you who are new to council, welcome to council, everyone. My name is Raquel Garcia. I am council chair, Dr. Nagel. It is so good to have you in this space. Welcome to council, everyone. If you need to review the outlines, there is a BHAAC meeting packet. That meeting packet will prepare you for the meeting today, our guidelines. Judith, do you want to drop that in the chat? We're glad to have you. We ask that all members of the council and public review this material as we begin the meeting. In this packet, you will find information about ASL interpretation, closed captions, group agreements, codes of conduct, and hyperlinks to various resources. If you have any questions or need any assistance, you can contact Megan Shelton or Tasha, and I will be happy to help you. Megan can be a little overwhelmed with work, but also Tasha and I will take care of you. And just reach out to us for any questions. We've been here for a while. Tasha and I are inaugural, so we can help you find whatever it is you are looking for. We'll go over the agenda. We are going to review and approve our meeting minutes. Council, those were in your packets. There's a link in there for the June minutes. If you want to take a look at those, we'll review and vote. Then we'll have a council debrief of 2024 and 2025 council applicant appointment process. So we'll go through what that process was. We'll have a council debrief on the grievance system. Is this the right one? It is. Okay. Sorry. I was feeling like we were repeating ourselves. We are going to review that. BHAAC connection opportunity. Tasha and I'd like to talk to you about something we're planning. We'll talk about the Basso Regional Council Selection Committee. I saw those emails go out. They are looking for regional council members. We'll talk about the ASAM 4th edition. We'll have a briefing on the community engagement and standard operating procedures for that ASAM level 4 or the ASAM 4th edition. At 9:30, we'll have a meet and greet with the new BHAAC members. We'll get to introduce yourself. You'll get to introduce yourselves. We'll have a break. And then we'll have a council administrative review we'll go over annual reporting. We kind of have a new structure in the way that Tasha and I've decided we wanted to have community input about that. And we'll talk to you about that. And then we'll open up for public comment. So we've got a robust agenda today. Before we move forward, we are going to go ahead and review the June minutes and vote them in. Is there any discussion on the floor about the June minutes? All right, I'm looking for a motion to approve.
I make a
Okay.
motion that we
Tasha.
approve the minutes.
So moved. Thank you, Carolyn. Looking for second.
Tasha Conquer second.
Tasha, thank you so much for seconding. And the minutes are approved as is. All right, moving forward. Oh, actually, I didn't even call. All those approving the minutes, say aye.
Aye.
All those opposed. And the minutes are approved. I apologize for that stumble. I run a lot of council meetings. You'd think I'd have it right at this point. And Judith, do you know we can see your whole screen? Just making sure you know that. Thank you.
I think that's Melissa's screen. She's gonna switch over to the agenda.
Thank you. Next, hopefully you can see it. Judith, who's giving, and Tasha, do you know who's giving the debrief on the 2024 and 2025 the applicant appointment process? Are you doing that, Tasha? I think that's you.
Sorry, I just got home. I apologize.
That's okay. That's okay. I was just trying to buy you a minute, and if you need me, I can step in.
Thank you. Thank
But
you.
thought this is you.
I don't know. I don't remember. I just know I'm reporting on the report. So we'll figure it out.
So, Raquel, you're doing a debrief. I'm sorry, I'm stepping in today because Megan is
Okay.
out.
Come on. Yeah, come on.
Yeah. So, right now you have to go over a debrief of the council application process. I don't have that. So, if either of you are not prepared for it, we could send it in an email, or we could do a follow-up with the council if that helps.
Yeah. Tasha, go ahead. I can step in too. Go ahead. We'll figure it out. Go ahead, Tasha.
What application process are we?
It's the council applicant appointment process. It's
Oh.
it's for our council appointments.
Oh, okay. Okay. Yeah, I got it.
Yeah.
Um, to the new members, I sent out emails that has all the stuff that to go over with that. Our appointment process to onboard goes over it does the state boards slides and stuff like that, and then goes over the bylaws, read over those, and then our agreements. I'm trying to think of what else. I've done this before and I'm drawing a blank right now. Can you help me, Raquel?
Yeah, absolutely. So the process was we all our new council members are in. Everybody actually yesterday should have received your BHAAC letter of commitments, right? And so that we're signing those and we're returning those. So those are coming in. I've gotten a few of those coming in. Maria, do you have a question?
Mm-mm.
Okay, I saw you come off mic, so I was just making sure. So you should have gotten your commitment letters. If you have any questions about anything on there, please ask. And then from there, you'll do your commitment letters, and then you'll get signed letters from, I believe those come next from our commissioner. So those will be coming to you after your commitment letters. And welcome to council. It's really not, it's not complicated. We keep it pretty simple. So we are through that process now. And so now we have, and we'll stop later on in the meeting and we'll introduce all of our new council members. Now, I don't have a list of the new council members. I just happen to actually know somebody who's a new council member. So I just kind of navigate towards Dr. Nagel, but we will do an introduction of everybody here. And now we are getting a debrief. Actually, before I move forward, is there any questions that anyone has about how that process has gone down, how it continues to move forward on how we to the council appointment process? Okay, cool. Just want to leave it open for discussion if there was room or if there was anything needed to be spoken. Thank you so much. Let's move forward. Debrief of the one-pager document on the grievance system. I went ahead and put that in the chat as well. Want us to review that? I know we had some feedback about language. Dr. Rob?
So this is the new one. This
This
is
is
the
the one in our
updated one.
board packet because that word is still there, I noticed, right?
Yeah, like it's literally it's an advertisement for complaints. It feels to me still again that we are soliciting complaints. The BHA is soliciting complaints. It doesn't say for feedback. I thought we had discussed changing complaint to give feedback. Because there's no room for positive or negative. If I saw this at Applebee's and my coffee was cold, I'm calling that number. It's pretty easy to do, which I understand we don't want barriers, but why not just give barriers to feedback? Why plant the seed of complaint when we could plant the seed of feedback? So I still have an issue with it.
I would agree.
It doesn't look like anything was taken into consideration.
No, and actually it says complaint so much. I mean,
I
you
know.
start off with it saying file a complaint with the Behavioral Health Administration. The email is complaint. We talk about submitting more. We put it in purple about a complaint and we highlighted complaint. I mean, I would agree that it seems more, not that we're not wanting feedback, because we definitely do, whether it is positive or negative, but I do think that feedback is a more strength-based approach than a punitive approach. And isn't that what we're trying to shift? I'm going to take two hands. I'm going to see Carolyn's hand, and then I see Jennifer coming off mic. Carolyn?
Yeah, I just want to, I feel I'm along with the doctor there because I feel like we can complain all day, but are we really accomplishing anything? And so I feel like if there's something on there that says ideal solutions or something like that and give people opportunity, excuse me, give people opportunity to have voice in how they feel the system should correct itself, how it can get better towards individuals and more intentional. So yeah, I'm along that line too. I don't want to just complain. I just want to hear solutions.
Yeah, I'm hearing that more solution focused, more strength based feedback are the words that I'm hearing that should be woven through the document and art. Jennifer.
One question for clarification. So is complaint and grievance the same thing in everybody's mind? It's the same
Yes.
process? Okay. Okay, I just wanted to make sure that that was clear
Yeah,
in my
this
mind.
is that grievance process
process.
is what
Okay.
what the BHA is saying, but we're open, like we don't have to live with this. So
Okay.
any feedback's welcome.
So
I
Raquel,
like,
oh, go ahead. Sorry.
no, I like the idea that Dr. Archuleta just mentioned about feedback, because I think knowing what's working and hearing the successes is just as important as hearing the grievances.
Go ahead, doctor.
Oh, sorry. I was trying to find the hand thing. So I was trying to raise my. Yeah, I just feel like, the reason this council was assembled, right, is because we're all people with lived experience, whether we're providers or not. We've all navigated the system, and we are clearly saying that complaints is the wrong verbiage. And so, like, we're the ones that have been there. We have had those complaints, right? But we also have had those positive experiences. And so, like, we should have an equal opportunity, especially this thing, like, tease it up. It's like, we know that submitting a complaint is not easy. It's pretty easy. Like, you know what I mean? Like, this person that wrote this must not have ever been on, what is it called? Not where you rate restaurants and stuff. What is that called?
Like a
Yelp.
Yelp. Yeah, this
Yelp,
person's
yeah.
never been on Yelp because there's not a lot of positivity on Yelp. So, we want to say, like, I think that the verbiage can say, we know that giving feedback, positive and negative feedback can be, daunting or blah, 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 like it literally feels like you're soliciting complaint. And let's just be honest, the demographic that we work with, and even as a provider,
Yep.
they're unhappy. Like, they're not, why have to navigate all of that? Like, they're not going to be happy with 90% of, like, the things that, are recommended or that come through. And it's not a perfect system. As a provider, this feels a little deflating, and like I feel like, as a provider, unsupported with this. I know we want to support our patients, but we're already a safety net provider, catching the people that fall through the cracks. That's what we do as a provider. Why people already are having difficulty working in this field, why it feels a little deflating and unsupported.
I would agree, especially as a provider. I second that. Tasha and then Carolyn.
Tasha Conquer here. We all know I like to complain and keep transparency and accountability. And with this form and the way that it's set up, to me, it's gearing more towards the negative instead of focusing on the solution. And that's something, after 3 years of being involved with this council, is coming with a solution instead of just bitching and complaining all the time. You get more bees with honey than with the vinegar. So I definitely think that feedback needs to be implemented in the wording instead of complaint or grievance or whatever. So
Yeah, absolutely. Absolutely. Especially if the BHA wants support from the providers. If you want our support, then we would like to also be supported out in the community. It is hard enough to do this work. let alone having a complaint department that is literally feeling like they're just demerits. And it's not that, and I'm a provider that also is real, recognize that there are providers that don't do great service. And so we also need to talk about them. But then I agree, just this, I can't stop seeing it. If you see how many times the word complaint is used, not only is it used, is it highlighted in this document? And we even made the email say complaint. I mean, if you want to talk about behavioral health and patterns of the brain, you are just reinforcing it throughout the document to complain, and everything is a negative. And so, by enforcing it across the whole document, highlighted, even down to the email address that you're actually typing in, for those of us who do behavioral health, we're just manifesting that. Carolyn?
Yes, I feel like a grievance is a way of helping the system improve. And I feel like the people who have the grievance are the ones that know best into how a person or a system or a center can be more supportive towards them. And so I see grievance as a way of helping, not a way of just complaining and letting it go and just being out there. Because I also feel like when there's a grievance, right, like when we talk to the person, right, when there's follow up and the grievance is getting resolved, I think it's good for feedback to let that person know, hey, this is what we did. We talked to this individual about this, or this center about this, or this system about this, and this is what they're wanting to do moving forward. So I see grievance as a way of helping excuse me, helping, and I feel like the people that are filing the grievance are the experts in knowing how a system, center, or person can be more supportive towards them.
I appreciate that. Thank you so much, Carolyn. So just watching time council, I'm supposed to be moving on to the next one, so I'm going to make it really, really quick. I'm going to go Dr. Archuleta, Jennifer, Keith. We have to make it really quick, and then we'll have to make up some time, just
Yeah, I'll be
keeping
really
that
fast, and
transparent.
I don't want to keep repeating the same thing, but if what do you think the feedback would be if this was a letter for that went out to providers that said if you want to complain about the BHA or the BOSO system, here's and then we just change that to them. What would providers put into this? Do you know what I mean? Like it would tee it up for us. So I just
Yeah.
take that into consideration.
No, brilliant, brilliant, Dr. Archuleta. Thank you for that viewpoint. Jennifer Silva, then Keith.
So just one quick question. If we were to add the feedback mechanism, in addition to, when you're not having a good experience, what would that pathway look like? How would positive information be shared? What would that look like? And it may not be something that's answered today, but just keeping that in mind, how would that information be disseminated? And, kudos to the providers who are doing a good job.
Yeah, we did have a little bit of briefing on that in the last few
Okay.
months from the people who built this, and said that they will be disseminating that information, but I'm gonna tell you it's not probably coming in from the complaint department.
Okay.
You know what I mean? Like this is not
Yeah.
where I'm gonna go put good news. I would
Yeah.
not deliver good news to this form, to this email. It says complaint. Why would I give good
Right.
news
You're
to the
exactly
complaint
right.
department?
Yeah.
Right, I agree. It's a good point. Thank you, thank you, Jennifer. Keith, and then we'll move forward.
Also,
Yeah, I was just wondering. I hear the procedure and everything about the grievance procedure, but is there a procedure that records the results of what these people have gotten back as a result of the answers? Is there a system in place for that?
Yes, they do. They had presented to us several times on their process, and they do reach out to the organization regardless that there has been something that came in. I'll have to go back and review, but I can find the recording and you can watch that over again, Keith, to see what their process is. Off the top of my head, I can't remember what that is. Yeah, the Performance Hub. Thank you so much, Tasha. I appreciate it.
can I add something?
Yes, go ahead.
Yeah. So I understand like the grievance process, but I think to move it forward too, like sometimes I think of it as, what are the challenges you face working with the system and then areas of improvement, because that'll actually give us feedback. So for instance, for me, I would say, well, my 20-year-old son got admitted to the inpatient behavioral health and I was not allowed access, even though I was healthcare power of attorney because he's an adult and I had to get, but he wasn't cognizant enough to give me his 4-digit code. Like, so, I would be complaining about access, but then I think I would also say, and, these were my challenges, I need help with it. And it would really kind of improve care if, parents were given access, particularly if their child did give them healthcare power of attorney, because it seems like the psychiatry services are completely separated. So I think sometimes then we have some action that we could take, because we may have many of the exact same input, like many of the same challenges, grievances, complaints, but many of the suggestions of, we think it would be better if we can do this.
Right. I love that. I like what we were talking about, like it's Tasha was talking about, solution focused. People have great ideas. We should solicit them their ideas.
Yeah.
All right, thank you guys. I'm going to move forward. I appreciate that. I think that was a great, robust discussion. Look at us giving feedback, team. Now we're going to move forward. We're getting an ASAM 4th edition Community Engagement Standard Operating Procedure. Who is delivering that today?
So this request came in. I don't know if
Caitlin Long is supposed to be
Caitlin Long.
presenting on
Yes.
that today. I don't know if she's here or what's up with that.
One moment, let me check the attendee list.
Okay, thank you. And I just want to say thank you to the new members for all your guys' input today, this morning. It's greatly appreciated. And I'd love to see fresh out the gate, boots hit the ground. So thank you. I appreciate that.
I don't see Caitlin in yet, so I would recommend we can move it to a little bit later in the agenda.
All right,
Then
well,
we
let's
move on to
do
the
a
next
meet and
item.
greet. Let's introduce our members. And like I said, forgive me, please, because I do not have a list available to me to know who is on that list. But I'm going to be brave and have you, or ask you to be brave and just kind of raise your hand if you're new to council. And I would love, I think we have 15 minutes. I'm going to curve this to about 10 minutes because we are 6 minutes behind schedule, just to keep us on point tonight or today. Dr. Nagel, will you actually do this? Because I actually know you are new to council and I actually know you. So I'm so glad you are here, Doctor. Welcome, welcome. Let's hear a little bit about you. Keep about like a minute or so and we'll move forward.
Yeah, so good morning, everyone. I'm a professor in the departments of neurology and ophthalmology, and I'm joining this from the perspective of a mother with a young son who had first episode psychosis, then had a second episode. It's super challenging, dropped out of college, and we're still working through that and trying to work with the Ascent program. And then also as a physician and infectious disease researcher, because now I'm on the board of the International Society of Neurovirology, and we're finding this really interesting convergence with how infection and brain inflammation can worsen serious mental illness. So like I had no idea until my son got strep throat that months later he suddenly presented with obsessive compulsive disorder and vivid hallucinations and catatonia, that something as simple as a strep throat could trigger that. So I really started to focus my research on that. And then just as a final note of how this really has come together, next week I'm actually getting an endowed chair, the Cockrell Whitmus Endowed Chair, which provides me funds to look at and including to look at research, including mental illness, particularly in women. So this just all came together at a great time, and I'm super excited to be part of this group.
Thanks so much, Dr. Nagel. Glad you're here. Jennifer Silva.
Hi, everyone. I'm Jennifer Silva. I'm a Chief Clinical Officer with San Luis Valley Behavioral Health Group. I've been a social worker for about 30 years, and all of my career has been working in rural healthcare and with the underserved. So very excited to be on the council and to work with everyone.
I'm so glad to have representation from the San Luis Valley here.
Thank you.
So my heart is in the SLV.
Oh, thank you.
I literally have goosebumps. Love the SLV. So glad you guys are here. Hardest hit by the opioid crisis.
Yes,
so
we are.
Present.
Yes,
so glad
we
you're
are.
here.
Thank
Grateful
you.
to have a voice present at the table. Any other new councils? Oh, Kari.
Carrie?
Yep. Is it Carrie Parchinsky? But my hand won't raise. That's okay. I'll just let you let you talk. I see you in the chat. Oh, I see my friend Preston. It's good to see your face, sir. Welcome. Carrie, can you not come off mute?
I think Carrie might be having issues with the audio.
That's okay.
She said yes, she cannot.
Welcome. Do we have any other new council members present? I just said hi to Preston, but he's an old council member.
Yeah, I was finally able to join. I was having some technical difficulties for the last two meetings we've had. So
I'm so glad you're here. If y'all don't
Yeah.
know, Preston represents our Southern Ute Nation. We're so super excited to have him here. My brother in the four corner.
Good to be here. Thanks for having me.
Yeah, it's good to have you here, brother. All right. Well, if we have no other council members that need to introduce themselves, do we have Caitlin here for? Go ahead, Tasha. I see you.
Kari put in the chat that she can come off mute, I believe.
Yes.
Or she's unmuted.
Oh,
Yeah,
come in,
there you go.
Carrie.
So sorry. Yes, my name is Carrie Parchinsky. And I'm not sure, was there anything else that you wanted me to add?
Just a little bit about yourself. What brings you here?
Okay. I am a licensed professional counselor. I've been in the profession for about 20 some years, and I just really have a passion for the training and policies, and I just wanted to be a part of it. So I'm really excited to be here.
Grateful to have you here. Carrie, what part of the state are you in? Just curious.
I'm actually up in Crested Butte, Gunnison. I work with Griffith Center, so I travel into Denver, Grand Junction, Colorado Springs, about every other week or so. So I am in the greater areas, but my home base where I work remotely from is up in the mountains there.
I love that.
So lots of rural work.
Yeah, that's another reason why you're here. Welcome, welcome, welcome. We have such a good wide range of and a good diverse population in our council. So honored to serve alongside each and every one of you. Do we have our presentation for the ASAM 4th edition?
Caitlin is writing to me now. I don't see her in the attendees yet.
Okay.
I'll let her in as soon as I see her. Thank you so much for your patience.
You're welcome. Well, actually, then we're going to go ahead and oh, Danielle, go ahead.
Thank you, Raquel. Sorry, I just wanted to tell Carrie welcome. And Carrie, I'm in Delta, and my agency serves up in your area. And if you ever wanted to connect, because I'm pretty new to the council too, and I'm just learning, feel free to reach out.
Well, one thing I actually skipped over. Thank you so much, Danielle. I actually skipped over it on our agenda, which was to talk about a connection. And so one thing our organization, wrong board meeting. One thing, council, I actually, the first time I remember meeting Tasha, was way back in the day. I feel like that's old, but it is. When we first started our council, and most of us hadn't met online. Hadn't met in person. And so what Tasha and I would like to do is coordinate a hybrid, because we recognize that everyone might not be able to make it in person. But we do want to coordinate an in-person meeting so that we can actually meet. I cannot talk about council business. It's actually not, it's actually against council rules to discuss council business outside of it, but just a social connection. So we can know, like, that's what prompted me, Danielle, when you said that about Carrie, is like, we should know who we are, what we do beyond the piece of papers that we read, to know how we connect, right? Like, I know Preston. I've actually been to the reservation the last few years. So I think it's really important that we actually know each other. Dr. Archuleta does great work in Pueblo, and to know that about ourselves, to get a little bit more personal about that. Wondering what that looks like for everybody. We are thinking about October, and probably doing something hybrid, which would be a combo of something virtual. thoughts, feedback, ideas?
I was wondering, so for those of us who are on the rural side, we're pretty used to coming to Denver, so it's not that, but um, perhaps those who struggle more with traveling for various reasons, if we could maybe offer an in-person, like on the rural side and an in-person on the urban side. Not because I wouldn't come in October to Denver, and I will try if it's available, but I-70 is just such a nightmare anymore. And it used to be the summer was the best time for I-70, but like every damn day they're closed lately for a million reasons. And
Okay.
so, and then just selfish feedback is it is hard to get people from the city to our rural area. And I think it's helpful, even for BHA members to be like, oh, it really, really is different over here if you're not from this rural area. So,
Great point,
yeah,
Danielle.
thank
Great
you.
point.
Absolutely. It's actually one of the greatest gifts I've had is to be able to go. I actually like to get out of Denver as much as I can and hit the rural communities. And that's something being said too, is those regional councils, is to jump on those too. We are going to be looking for and requesting that one BHAAC volunteer be at each one of those BASO region to review those regional committees. So the BASOs are going to have a regional committee across the state, to kind of hold them accountable to the regional work happening. Those are also opportunities for us to actually influence that space by going through and reviewing those that are applying for those regional councils. So that's another way that we want to be involved in rural community. We had been on tour with the BHA a couple times. I know that it's really important for Commissioner Smith to get out as much as possible. She's actually been one of the most visible presences that I've seen since I've been on council, that she tries as much as she can to get out there to talk to the community, to get feedback. And so I agree. I think we could, like, we're thinking like to start off with twice a year. Let's just see what happens, and we will do something hybrid. So that means those who cannot be in person, we will do something. I have an office in Castle Rock. I can actually do hybrid presentations or something like that and get people in Zoom. But we're thinking something, we haven't created what it looks like, but I like the idea of doing one on the western slope, one on one side of the divide and one on the other side of the divide. We can maybe split that.
I would suggest if we have some dates, we can put out a doodle poll. And then, then everyone like if you're thinking twice a year, just say, okay, here's the 8 weekends in the fall and then 8 weekends or weekdays. And then we can all just, we can do a poll with the times and then we can decide which is the best. And then there's a possibility I might also be able to get a hybrid room for us at the Anschutz Health Sciences building for that, where they already have all the whole Zoom thing set up.
Yeah, absolutely wonderful. That's great. Thank you, Dr. Nagel. Yeah, we'll have a doodle poll go out. We just wanted to see some feedback about thinking if that was a good idea, if you guys had any, quick thoughts. And then I do want you to consider also, when we're going to go to break, we talked about the BHAAC connection opportunity, but also want to look at that BASO Regional Council Selection Committee, right? And we are going to ask that one BHAAC volunteer for each region to review them. You don't have to be present at them. And I'm going to be very, very, very bold that, I think our executive committee, myself, Tasha, Catherine, Carolyn, are tapped out on, being on review committees, and I'm at bandwidth. And so I do want to ask that council steps up and helps us to inform those BASO regional councils. And the other way that Tasha and I are going to include y'all this year is every year we are together and we put together, and Carolyn and Catherine and I put together the yearly report. And I recognize for bandwidth reasons and timings that y'all can't be a part of that of that committee. And we don't mind that. We're saying, okay, we'll step up and build the report, but what we need is your input. And so we're going to create a form that will go out to each of you asking for your feedback on specific items within the statute. The questions that they ask us every year in statute, we have to answer in a report. So we're going to put those questions to council, and it'll be a form. We just need you to fill out what you think. If you don't know anything, you don't have to fill it out. But what it will do is we would like a more inclusive report. Tasha and I are in it. Carolyn and Catherine and I are in it. Keith is part of that too. but we don't have a whole council view. And especially when we're talking, like Danielle, you're talking about that Western slope, or there are small rural regions, or Jennifer, you inputting from the SLV, it's important that even if you're new here, you can give feedback. It's on the BHA and how they're doing that. Like even Dr. Nagel said, I'd like to give some feedback on how things can improve. This is where it goes, and we have to submit this report in statute by September. Tasha will remember the date, I won't. But we have to turn it in. So we are going to ask you guys to complete that form and give us feedback. We'll give you about a week turnaround time so that we can get in our committee and build it. Then we will bring that report. You guys will get a copy of report, and you have feedback from Tasha and what we create in council to give us feedback to see if we missed anything before we submit to commissioner so that she can present it to the legislature. I got that right, I think, Judith, and I got that right, Tasha. Anything? I know you got your hand up. Go ahead, Tasha.
I was just gonna say, I know that I was gonna go over this in more detail after the break about this. So, with the report and everything, but this was a way that we had talked about to get all of council's input. So it's everybody's feedback instead of just like subcommittee taking it to,
right.
Council members during council meeting and stuff like that. So this is a chance for everybody to put their authentic input into this, and then we'll go over it in subcommittee, in the report subcommittee. We'll go over it and put it all in the report. So it's a way for everybody to have their input all in.
Yeah, inclusivity is something I'm not ashamed to speak about here. We are going to keep having that conversation in this space about inclusivity and equity. And inclusion means having and at least at the very least, Tasha and I will feel that we have attempted to get everybody's, I can't make everybody give their input, but I feel better that I've asked for everybody's input in the most viable way. And if the form is too daunting and you want to meet with Tasha and I, you can, Tasha and I are willing to do a one-on-one and pull that information from you if the form doesn't feel accessible to you, or it's clunky and you using, or technology is not your BFF. Please set up an appointment with Tasha and I. We'd be more than willing to listen to you as well and get your input. Tasha, go ahead.
Judith put the feedback form that Megan had put together for us in the chat. So just let you know the feedback form is in there. And yeah.
And we will definitely send that out also in an email so that you guys get it. Also, if you can't download it, we'll send you an email. I see you in the chat, Julissa. I can tell you right now that we searched far and wide for folks, and we want more representation, but I also struggle to get, people have to apply for that position. And so we do want a greater representation of that. I think that please, when we're asking for those folks to be present, we want them here. But I need them to come and want the table, the seat, and we did the best we can. And maybe if you have any suggestions on how we could be more inclusive in getting a wider range of people and a more diverse population, please, please, please let me know. I know that they did social media posts, emails. It went out to 13 other councils that distributed the information. But I think, I think that might be a challenge, right? Is how do we get more representation at the table? But of course, as a minority woman, I'm definitely interested in making sure that we have representation of the immigrant, refugee, and Spanish-speaking communities. And here's the thing, to be on council does not mean you can't be present. So I always tell people, look, we have council meetings. People ask me all the time, I'm like, look, just because you're not a council member doesn't mean we don't open up for public comment, and we want your feedback. So I actually last week was in community, and I gave someone the website with a link to our meetings and said, come to our meetings. We still want to hear from you. We just are representative of it. It doesn't mean that we can't have your voice at the table, even if you're not a voting member,
Can I add something in right quick, Raquel? For the regional subcommittees, for the BOSO subcommittees, those appointment seats or those seats are going to be open. So since we've already filled our seats with BHAAC, I would highly suggest to fill out for the regional subcommittees, because then therefore we get more community involvement there. So definitely apply for the subcommittees and put that out to the different representation for immigrants, refugees, Spanish speaking communities and stuff like that. So yeah.
No, that was a great thing. Yeah. Jalissa, please. Yeah. And if you need more about those committees, you can get Tasha also. But there are other committees where we could spread that diversity across, which is really good for us, actually. It's great because then we have allies in all the regions and we can check in with each other. Danielle, and then we'll move forward.
I was just going to say a recommendation that I have is that when you're trying to get some of these diverse populations, I think that we don't take into account how complex it can be to get through the application process, or that a lot of times it's written above the standard reading grade level in our state. And so, because we have to use statutes or say things or that, people easily get overwhelmed. And another thing we've just noticed when trying to get a lot of different voices to the table here in a rural area, we have to spend a lot of time with reassurance that we're never going to disclose status of if they're documented or undocumented, or we're never going to share anything with DHS. And so those are real legitimate fears. And two, I can just say until I kind of got dragged into some of these meetings from my professional side, most people don't understand BHA or any of that. And so I think that that's also a reason too, they don't know why they should get involved and have a voice, because the where the heavy streaming all the time is the ray. And so people are very confused when we start saying BHA, BASO, all of those things. And so what I've been screaming is we really need some kind of very simple tree chart, something that's like hick puff, right? So people understand. And so it's really hard to get people's buy-in when we don't provide simple basic education. And just some feedback I would give, positive and negative, is Tasha has been the most welcoming and taken all of my panic text messages when I can't get on a meeting. But what I would recommend moving forward when you bring new people on is that I would have done so much better, and I still sometimes feel like I'm struggling, if I would have got like a buddy. Like, here's my person who's already been on this committee for 2 years, and they're going to check in with me a couple days before the meeting and be like, do you understand? Do you do that? And so, especially when we're asking huge minority groups to come to something that's not normalized, to have all of these conversations, it's not fair to ask them to come and then not provide the follow through support. And so if I've struggled as a professional coming here, I couldn't imagine coming without any support, especially a person that's coming with just lived experience where the system hasn't always been kind. And so my feedback would be we could really benefit from some mentoring on this committee, and that would create a more welcoming environment to those who are nervous to that.
We appreciate that feedback, Danielle. Yeah,
Thank you.
And I love the idea. I wrote it down of the I also think of an orientation and mentorship. I can tell you right now, bandwidth and shift of the state's been quite a challenge, and it's something we have a goal of. So I'm glad that you spoke about that, because that is something Tasha and I talked about, is giving some mentorship and guidance. We just got through even creating packets this year, so we're getting there. And so I look forward to eliciting more of that and what that would look like. And we are really happy to build that out and maybe draft what that looks like behind the scenes. We can do a committee or something like that that would help bring that to life. I love it. I have to move forward because of time. Tasha,
Sorry.
I need to talk to Judith really quick. Judith, what you need?
I was going to say thank you so much, Danielle, for your comments about, visibility and awareness of BASO. What's the difference? That's really great feedback for BHA. One thing we've done, to start with, is to make sure that our BASO region shifted to look just like the RE region. So that's kind of a start for us, but I'm really looking forward to making sure that, we get the word out there for what the BASOs are, and, the difference between BASOs and REs, and how can we make BHA be in the community more and have brand recognition, for the BASO. So thank you so much for that.
I remember
for that
too,
comment.
there's a slide I looked at from the commissioner, Tosh and I were meeting, where she kind of had shown like how it all works, and you kind of saw where HICPUF was, and then you saw it. So when Danielle was talking about that, I kind of saw that slide come to my vision that she had drawn, and I'm like wondering if we could get something very infographic in multiple languages. Let's speak about that too, that says, "Hi, this is what the BHA does," because I am in community going, okay, so here is the money, here's the BHA, here's what the raise do, and I'm constantly like trying to infographic that myself. So I love that you brought that to light, Danielle, because I think like right now I'm watching the rays starting to talk about who they are. I shared something about the rays, but I think that overarching tree that Danielle talked about would be beneficial. All right, I have to move forward because of time. Judith, are we breaking or do we need to move forward?
We are breaking. Caitlin will be on at 9:55, so she'll be ready for us after break. Thank you so
Awesome.
much.
All right, we're going to take till 55, y'all. See you guys back here. Get 5 minutes.
What's up, Raquel?
What's up, Doc?
You guys busy?
The state shifting.
Yeah.
Are we busy? Slightly, slightly. State shift has everything. And my saddest thing, and we'll move forward, is watching peers lose their jobs. That's the one thing I'm heartbroken watching social media right now. They're just getting laid off left and right. If you're a peer and you're here, we're fighting for you, just so you know.
I I also, I'll just throw this out there real quick. Like the workforce development dollars have kind of disappeared, right? But I know when we were there at the Capitol, they said there was a continued investment in creating a workforce, but we need the dollars for the workforce development. We have people just saying like, I'm not going to get my credential. I'm just going to go to a different field. So I think that's really hurt us, losing some of those workforce development dollars.
I agree. It's not helping that we're about to go into special session for budget cuts. Let's let go of a bridge.
I think one thing that's been heavy on our hearts is that HHS memo that just recently went out about undocumented individuals and no federal funding for them. I think we're waiting for more clarity, but that's heavy on our hearts.
Absolutely. Especially our border states.
Yep.
All right, Caitlin, I think we're taking it away. ASAM 4th edition.
I'm looking through attendees. I have so many boxes on my screen. One moment, please. She's trying to join.
It's always stumbly. We had to let Megan go on vacation. She's got to get a break. I'm glad she's going. So Judah, thanks for stepping in. And it's going to be good to see Caitlin again. I hope Megan comes back refreshed. Well, we kind of jumped ahead because we'll be looking at times, but we did while waiting for Caitlin. Moving down through that administrative review, we've already kind of touched on that review process for completing that annual report. So we did see the link for that. We'll send out another email to Tasha Nelson and an email again with that link for that form. And we do need that form right back by the 31st so that we have what's the submission date for report, Tasha, that we have to hit? What's our deadline?
Submission date for the report is September 1st, but we have our BHAAC meeting that we have August, I think the 21st, I believe it is. In August is when we're going to take that to vote. So everything needs to be submitted before that date. Like I would say, yeah, about a week before that date. So we can put it together. So appreciate you guys. Did I explain that all right?
Yeah, that's great.
Okay.
Yeah, that just keeps us right on time since we're behind. Kind of jumps us ahead a little bit.
I think she's having trouble with the Zoom. Sorry, folks.
We have technology
before I joined this morning, it kept telling me my microphone wasn't working. It took me about almost 15 minutes to try to figure that out. She should be here shortly. Would that be the only item you have on the agenda left? Okay.
Yep.
Means that we still have some time. I wonder if there's anything else you'd like to dig into a little bit further.
Tasha?
If you would like, I can go ahead and talk about scheduling 2 report meetings prior to August August BHAAC meeting, which is going to be on the 21st, about submitting scheduling 2 report committees to go over all the feedback. And I'll send out an email with that. I'm coordinating that. Me or Megan. So
well, and I'll say for those of you who are new, like that's actually kind of like the meat and potatoes, right? Those are the things, and that questionnaire kind of shows you what we're observing for the year, right? So when you guys look at that form, Jennifer, and you're like, okay, so this is what I should be looking at, and we've like just gotten to this part too. It took us like 2 years, but like now we know ahead of time what we should be looking at for the year because we know the report that we have to give. And I would also suggest going and reading previous reports. You'll see that this council has reported accurately, even when we were pushed against not reporting our experiences. Tasha and I made sure that it was an actual experience, our experiences of the first 2 councils, the first 2 years was actually shared with the state. Fought very hard as people wanted to candy coat that. And if you know me or Tasha, we're not very good at candy coating. And so I think that, oh, Caitlin, I see you. Hi, friend. Oh my goodness. It's so good to see her face. She used to actually help take care of our council. And then they swifted her off to do some of this other big work, but it is so good. Caitlin's actually a big reason, to be honest, you guys. When you see the old council and the way we are able to kind of get ourselves together and really have some meat and potatoes about us is honestly because of Caitlin. She really came in and supported Tasha and I, where we didn't feel like we had great support before. So even the fact that we even have a council packet, all of those things that you're getting to experience was because Caitlin, who's about to present to you, was part and helped Tasha and I develop all of that, and actually was really the hands and feet behind that. So I'm so glad you're here, Caitlin. You've been missed. You've been missed. Can you zoom in? Are you ready? Oh, it's your microphone?
Yep.
I can read lips via Zoom now. I can. I'm getting good at it.
I think she's gonna try and log off and come back in.
Okay, I see that.
Okay. I think this is the more reason why I think it would be exciting for you all to plan to have a couple of in-person meetings, maybe once a year or so. You will never have to worry about technology.
Was there budget cuts to the microphones? Just kidding. I'm just kidding. Just kidding.
They're doing Zoom Lite.
Yeah. You only get a microphone that works for a half hour.
Well, it's got a 30-minute expiration time. Yeah. I know I got emails about special session last week. I was like, oh, here we go. It's gonna be a challenging year. One thing I'll say though is I like when I ask Commissioner Smith about that, she's like, Raquel, it's gonna be challenging. It is. She doesn't BS that it is going to be a rough couple years, and we'll still do this work. And that's what even my thing is that I know that it can be discouraging. There's things that are outside of our control. But really trying to say that those of us who believe in the work still show up to do it the best we can, huh, Dr. Archuleta?
Well, after making it through COVID with a skeleton workforce, I was working graveyards at detox and then coming in and overseeing the residential. You know what I mean? Like during COVID, if we could make it through that, I feel like we're set. Please deposit 25 cents to continue use of my.
That's funny. You took it way back, Tasha.
Yeah.
Please deposit 25 cents to continue use. Do you remember? He'd be like, oh, keep it going. I saw someone took a picture of themselves with a selfie in a payphone the other day. I thought that was great. Like ancient artifact. Are you here,
Yeah.
Caitlin? I see you in here.
Yeah, I still see Caitlin in here.
But not off camera and not off microphone. Off mute. Well.
My apologies, council members.
I was just going to say thank you, Judith, for all your hard work. You're doing an amazing job today. So thank you.
Technology anxiety is like a real thing when people can't get in the rooms and you're struggling behind. I always tell people it's okay.
Okay, so
We're still in time.
back. Yes, which is great. I know that, we've been really excited about this ASAM work and, really excited to share
There she
the work
wait,
that
hold
they've
on, I
been
see
doing.
her.
Yeah,
She disappeared. There she is.
but she's
But you're still
shaking her
on mute,
head.
Caitlin.
Mhm.
It actually shows mute, not microphone, just if that helps on the end.
There she is.
No, I can't hear you.
Oh.
Mm-mm. You're off mute, though. I know it is.
Mm-hmm.
You're off mute, though, so that's a good sign. I had to do my speaker and test it for some reason this time.
And I'm sure she knows this. When you click the audio arrow, just making sure that, yeah, both the microphone and speaker are on the same. She's going to call on her phone.
There you go, Caitlin. Smart. Where there's a will, there's a way. Yeah, right, girl. Work around it. Yep. I see
Thank you
you.
all for your patience.
You just got to pivot. Patience and pivot. She'll have about 20 minutes for presentation before we have to open up to public comment.
Can you all hear me?
No, you were echoing.
Okay, what about now?
Yes.
Better.
Success, Caitlin. You go, girl.
Goodness, that was a pain. Good morning,
There you
everybody.
go. Welcome, welcome, Caitlin.
I'm so happy to see you all
So good to see you. Your
today.
turn.
So happy to be with you all. How's everybody been doing? It's so good to see some familiar faces and some new faces here. Dr. Rob, Rishkel, Tasha, hey everybody. So happy to see you all. Well, sincere apologies for that technical delay. It kept saying that my Chrome needed access to my microphone, but then wouldn't allow me to get the microphone access because that is an OIT function. So I'm going to be contacting some OIT after this. But anyways, we have phones for a reason. So thank you so much for being here today and allowing me to come speak to you all. So since I'm not going to be able to screen share on my cell phone, let's see here. I'm going to just kind of scroll over and see where we're at. Perfect. So I know we kind of got this out to everybody a little bit late. Rules has been just as much chaos as the rest of the world right now, it feels like. So we're just rolling things out as soon as we can get them. And so I reached out to Megan and team on Tuesday. So I really appreciate you all pivoting and allowing me to have some time and space to be here to talk with you all today. So I'm not sure how far you all have gotten in this document yet. Have you been able to kind of read over some things? Do you have the first sight, any giant comments, questions, concerns? Kind of wanted to hear where you all are at right now and then kind of go from there if that works. Dr. Rob.
Yeah. So can you hear me?
Yes.
Yeah. So, I mean, we haven't really gone over this, but I know with the ASAM rule changes, the big hot topic for this right now is the withdrawal management 3.2 going away. So is that for sure happening? Is that what we're hearing? That because we we still have not got confirmation that that's going to go away. And then, the second question is, will there be funding for people to convert their withdrawal managements into 3.5s? How will the BOSSOs and the BHA support that? We've had several meetings,
first
but
break was only supposed to be a 15-minute one.
it's going to impact our communities. And then also, like, this is just my provider hat being on, like, is the BHA, does the BHA have a plan to educate the community so it doesn't look like, we have 4 withdrawal managements that are 3.2s, and then we're just shutting the door. The hospitals are going to feel like we abandoned them, like, we're going to do our own PR. We're already kind of trying to get ahead of it, but will the BHA be doing, community, education on this? Because hospitals are going to get hit hard when those go away.
Yes. So, yes, 3.2 and 3.7 are no longer going to be standalone treatment. So they are going to be incorporated into other levels of treatment. So not going away, but they are going to be kind of shifted and moved, and things are going to be done differently. So I don't want anybody to freak out being like, there's never going to be a withdrawal management again, because that's not the case. It's going to look different, and how the protocols around it, those are all going to be different as well. So right now, we're still very much in those early phases. What our primary focus is community engagement, community outreach, and community education. So just as much as we want to educate the community, we need community education from you all as well. So that's primarily what this SOP is for us to kind of get out there in the community, start doing some of these role stakeholdering with these primary audiences that are going to be significantly impact. We wanted to come today to ask you all, who do we need to reach out to in these areas? Who do we need to talk to? Our plan is, in addition to doing all of the stakeholdering, we're coming up with a handout as well as a video for to educate community members basically about rules and how to get involved in this process early, so we can get as much feedback as possible. So when this transition does happen and everything is implemented July 1st of next year, it's a lot more smooth of the transition than it just being kind of like thrown at everybody. So that's our primary focus with this today. That's our primary focus with this today, is just asking you all, based off this information here, who do we need to contact?
They didn't see.
So I see some hands up. Jennifer, do you want to go ahead and go?
Yes, one suggestion I would have would be law enforcement in local communities and local EDs.
Yes.
When we saw the shift and change with crisis services, when crisis services were no longer able to respond to the EDs or jails,
got some suck asses.
A lot of the providers got the brunt of the message because we delivered the message, and it was all of a sudden you're deciding not to do this versus no, this is a change in the system. Yes. And we're still dealing with the pushback. And so for those local law enforcement officers who are used to taking someone to a social detox, that's going to be a huge shift for them, especially when that service is no longer available in a rural community.
Right.
It's going to go, it's exactly what Dr. Archuleta said. Those people are going to the ED. The ED is already dealing with crisis clients because we're not able to respond. So this is in addition. So there's going to be a lot of education and probably feedback from EDs especially.
Yes. And so those, that's exactly who we're thinking of on page, I believe it's page 2. If you look under targeted audience and strategic messaging, we're still developing that strategic messaging right now. But that's kind of where our game plan is of how to develop this. But our primary audience is, as you'll see in number 4, first responders, law enforcement, hospital departments, or EDs. Absolutely. We know that those are going to be significantly impacted. And so we want them in the beginning of the conversation with the providers as well. We want everybody in the room together because we know this is going to be significantly different. And it's going to look different for each county, each location. What's going to be in Denver is going to be completely different than in Grand Junction or El Paso. And so we want everybody involved in these conversations, and we want to help you all kind of figure out the next game plan for how to implement these and create that seamless transition. So we do agree that law enforcement, first responders, ED, we want them all in the room with us.
And the $1 million question, Caitlin, is going to be, what do we do in a rural community when we don't have social detox? That you're going to hear that from every stakeholder. What do we do in this situation? What are we, how are we supposed to respond when that service is no longer available?
Absolutely.
Well, we've been in some of those meetings. They're already saying they're going to jail. Some of the smaller rural communities have said that in the meetings that we've been in, that they'll end up in jail.
Okay. Yeah, that's what we
because
don't
there's
want.
not room for them in
But
the
right,
ED.
right.
Yeah, I definitely have a concern too. I have there's a new project starting in Douglas County that'll will go between Douglas County Jail and Skyridge Hospital. And so I think you do have to include those two, and even behavioral health, those three, our three networks are so inextricably connected. That it will, I mean, it's going to influx my responses. I mean, it's going to increase how much I'm responding to hospitals or we're responding to hospitals bedside. Um, and that's where, I mean, there's not that service everywhere. So oftentimes in Douglas County, that people are left in EDs to detox for days with no connection and nothing else to do, Jennifer. So, and I do know that from hearing that coming down to visit Alamosa, we're in talks with the hospital there because of the same reason. And it's already a struggle. Now we're going to remove it and just add an additional level of stress to communities. So,
right. And keeping in mind, they took the brunt of the crisis contract, and now we're going to add this piece as well.
Danielle, Keith, can you please put yourself on mute? Thank you.
The other question, some of the other tables that I sit at, is the clarification around crisis providers. When we're talking about what type of level of care would this roll into? Are we talking a WIC? Are we talking, what level of care? Because a lot of those standalone entities aren't set up to do withdrawal management, especially a WIC. So just more clarification. I'm just hearing that at a lot of the tables that I sit in with that crisis piece is what level of care, and are they prepared to provide that with their current standards?
Well, and I think she said something too. You said, that it's rolling somewhere, it's not going away. Where is that? And who's absorbing that, right, Jennifer?
Exactly.
Yeah, I know it's not going away. Okay, then where's going it and who is absorbing that? So those are some questions. Danielle and then Tasha.
I was just going to say that I think it's great that we want to involve the hospitals and things, but I also think that we need to think beyond that broader spectrum. Like just looking at the last list release, that the first 6 hospitals to potentially close in Colorado, given all the new stuff, all 6 of those hospitals are rural hospitals. So, and one of them is Delta, where I live. So if Delta goes down, we have 2 in Junction that are already over inundated, and they're getting their first taste of having no mental health place to go. Montrose is already over inundated, and Gunnison can't maintain either, and then it only gets ruler. So I think that what's really important, who really needs to hear some of this conversation at the table, is Pick Puff, who's created these contracts, because if I have to sit in one more meeting where they're like, everyone just needs to collaborate, I don't care if we collaborate until we all die. Collaboration does not create services, and collaboration does not create employees for providers. And so I think that if we could move from the mindset of, oh, we just need collaboration. Yes, we need collaboration. Okay, fine. But you can't collaborate what doesn't exist.
Yeah.
And so that is like the tree I die on. Like, I'm so tired of sitting in meetings. So yeah, okay, we can call all the social workers from the hospitals, but let's be realistic. We need those CEOs to be like, realistically, this is where financially where we stand. How likely can we take all these uninsured or underinsured individuals with all these cuts? And so I feel like we have to be realistic about this conversation. And I know some rural communities will just put them in jail, but our rural community is kind of like, we're not daycare, and we don't have the room, and we don't have the staff to babysit them, and it's a bigger risk to hold them in the jail in case they overdose or this, that, whatever. And so I like, we're just not being I think, realistic about it. Like the meeting I was in yesterday, one of the ways our courts was like, well, we'll make up the money lost by making all the people who have addiction issues have to pay more money every month for getting in trouble. And I'm like, the same people who can't afford basic life, as they're going to be the people that make up the difference in your budget when you can't even provide them services to stay sober. I'm like, who comes up with these ideas? So I want to be realistic to be like, it's bigger people we need at the table who see who need to understand the true impact of what we're asking.
Yeah, and you talk about that safety net having to take everybody, they know this is like, did we fund them enough to take the windfall? Probably not either, right? Like your safety net providers are just gonna get slammed. Anyway, I
Before
don't know
we
who
move
was
on
up
to
first,
questions,
Tasha, then Dr. Rob.
I'm going to give people a little bit of a background for why we're doing this.
Yeah,
so statutorily, we are obligated to align with what's called ASAM, which is the Addiction Medicine of American Medicine of Addiction Sciences. It's this big book right here that I am going through every day on every time. And so we have to align to their standards for addiction medicine. And so they came out with this new 4th edition. And so that is what they are doing. So they have basically moved withdrawal management as a standalone and incorporate it into different levels. And so I don't want anybody who's like not familiar with this to think that like BHA is just being like super mean and we're just making up all these rules all of a sudden, because that's not it. Our hands are tied statutorily as well. So we're trying to do this in like the best good faith effort as possible. But we do understand that this is a significant impact everywhere. And so that's why we wanted to get in these conversations as soon as we possibly could and start working with you all, because, you know, what we can always come out in policy and say this is what we're going to do, but how it's actually going to impact communities and how it's actually going to play out, that's what we need to know, and that's what we need to work with you all, and we need to have these difficult conversations, and we need to be told, hey, collaboration is not always key. And I get that, Danielle, and thank you for bringing that up. And you know, and we want to keep working with you. And so I can tell you right now, I do not have all the answers, but I'm going to do my damnedest to be with you all through this entire process and learn with you all and grow with you all and try and make this as easy as possible. It's not going to be easy, and it's not going to be just an overnight implementation. Here we go. And I think it's going to take a lot of trial and error, unfortunately, but I do think that we can get it as close as possible when we have the right people in, and it's starting here with you all. So thank you, just first and foremost, for having me today and talking with me. And then I think Tasha is next.
My question is, Tasha Conquer here. When it comes to putting this in the jails, there are already a lot of the jails, I can only speak for El Paso County for one, that are neglecting the withdrawal and the proper help. They don't even have the staff to do it. So how are we going to put that on the jails to pick this up, to help, to collaborate all together? Like, how is that going to help when they're not even doing it in the first place?
Right. Dr. Rob.
Yeah, I think it's already going down, right? Like I've been saying, the wave's coming. We'll get on a surfboard. We'll surf. The one thing the BHA does have the opportunity and that they can help with is, we know it's going to roll into 3.5, 3.7. Dr. Samaro put some statistics, some good information in the chat. I think this is where it gets tough, right? So 3.5 is going to take a different, it's going to take all those agencies. It's going to change the demographic of patient we served. It's going to change the people that want clinical services, not just the people that are coming in for withdrawal services. 3.5 also has specific stipulations and hours of treatment that need to happen. With us losing our workforce development dollars, and this is like where hopefully the BHA and the bosses could come in, is because we've lost workforce development where, like, you know, there are either the BHA is going to be granting a ton of waivers for non-credentialed staff to work these 3.5s or 3.1s or 3.7 wherever they go. Everybody's going to be on a waiver because we're not going to have the CATs, we're not going to have the CASs, we're not going to have, and we already know that it would be an inappropriate use of peers to use them for monitoring, right? And so, like, this is just, I think, where the because this is already going down, we know it's going down. I think where it could be helpful for providers and the community just in general is how are we going to, there's going to need to be a whole different team managing the 3.5 than there was at 3.2. And then how do we get those people trained? Because that is a line staff position. And if you look at the $1,000 it takes to get, $1,500 it takes to get just a CAT, and then if you go with the CAS, and then if they fail the test and to pay for the jurisprudence test, you're talking this could come up to $2,000, $2,500. So I think that's where the BHA can come in and help, is looking at, how do we help fund the workforce at least? How do we develop the workforce? Because the workforce dollars are gone.
Yep. And along the lines of dollars, for those essential providers who are doing 3.5, 3.7, what is their stability? What is that essential provider rate? How stable is that? And I'm understanding that there are cuts in that area. So if this is what's kind of the plan for capacity, it's kind of iffy.
Doesn't sound like a very stable bridge.
Yeah.
Little wobbly, huh, Jennifer? I could feel it when you said it, and same with Dr. Archuleta.
Yeah, but I just want to say this. I'm a fan of ASAM. I know a lot of people aren't, but I'm a fan of it. There are positives that come with this ASAM, patient-driven care. One of the dimensions changes to patient-driven care. The other dimensions is including opioid treatment programs.
Yep.
There are some positives that are coming with this ASAM change, but I think that it's starting in a ditch by removing 3.2.
Well, and I think what we'll do council-wise too is I'll put together a general document of what even ASAM is for those of you who may not be familiar with that. We can do a really higher level, and I think going to what Danielle had talked about, simplifying what it is. I think for average community doesn't know what that is, and sometimes I didn't. I had to get in here and be in it and listen to Dr. Rob say ASAM 1,000 times in the last 3 years to understand the ASAM. I actually have a clinical background. I'm being funny, but I think that might be helpful too, along with that documentation of how the BHA works out and touches all the systems, is also to do a simplified version of what this is and kind of talk about those. For those of us who do provide services, Jennifer, Dr. Archuleta, Daniel, that do services, we understand it, but I think maybe making it how to counsel or speak to counsel about how this impacts community, right? I think that, and sometimes even though we're talking about it, thinking about the learning styles and how people absorb information, infographics and things like that might be helpful in making sure that our just being inclusive of all of our learning styles and how we absorb information is to bring something together like that. I love that idea. And Judith, I saw that, is that we could bring that higher level so that people understand even what an ASAM is and how it impacts.
So we are currently working on something like that right now. We're working on handouts as well as videography. So we're going to have video. We're going to have 2 different formats for people to be able to access to learn, what ASAM is. We're developing an FAQ. We're going to, like I said, we're going to have handouts. We're going to have videos. So we are, and then it's going to incorporate into rules, what are rules, how to get involved and things like that. So we are going to try, we are currently making with our comms team that high level overview, which we'll gladly provide to you all to review as well. We can even do that before we decide to go public with it. So as
Caitlin, I just got to watch our time. We got 2 minutes left on that thing, and I got to open up for public comment. So we might have to go a little over. Yep. I also want to make it something, and I want to bring our tribal family in here also, is that, I asked Preston how it affects that community, and he says it affects it greatly, and it's always a funding issue. Our tribal members have somewhat of a protection under the tribe, but not for the non-tribal community, and not everybody is in that community considered. So I think that's something to make sure that voice gets brought forward. I'll go ahead and move forward. Thank you, Caitlin. You guys can reach out to Caitlin also. She's available. She'll answer questions. If you want to sit one-on-one, she'll explain it to you. She's super inclusive when it comes to explaining things. I always say in a For Dummies version, which I prefer. Very simple, very plain English. Caitlin, you're great at that. We're going to open up for the last 2 minutes to public comment. Thanks, Caitlin.
Thank you. And when you all can, if you can reach out to me and take a look at this in more detail about the dates, location, and types of events. If there's anybody within these specific areas that we should reach out to, please contact me and let me know, because I will personally reach out to them myself to get them involved in these conversations. So thank you all. I'll be in touch soon.
Thanks, Caitlin.
Bye, everybody.
I just want to hop in here right quick and let you guys know that Judith did put Caitlin's email address in the chat, so feel free to reach out to her.
Thanks, Kate. Thanks, Tasha. And now we'll open up for public comment. Keith, I'm gonna not answer because it's public comment in your council. If you've got any questions, you can email us, and we can talk about it outside of the space. Open up for public council or public comments. You can raise your hand and Judith will let you speak, or you can also put it. Yeah, is that or we do Q&A, right? No, we don't. Yeah, we have the Q&A.
I'll be able to let folks talk if I see a
Thanks,
hand.
Judith.
Thank you.
Well, if there's no public comment, we'll actually leave on time today. It's 10:30. Seeing as there's no public comment, I am going to adjourn our meeting. Thanks, council members. Thanks, community. Thank you, Judith. Thanks for the flexibility. Welcome, new council members. We look forward to, especially, I love the conversation. I love that y'all are just getting in it. This is great. We've been waiting for you. Thank you, Preston, for being president. Thanks for answering my question in the chat. And we're going to hear some more from you. I'm going to unmute you more often, Preston. We need you. You're important.
I don't
Thank you
know.
so
You
much.
I don't know what you might get yourself into.
Yeah,
Sometimes I
already
can't
know.
shut it
It's
down.
okay. Bring it. All right, y'all
All
have a
right,
great
y'all.
day.
Have a great day. We'll see you.
Meeting adjourned.
Bye, guys. Thank you.
Thank you, everyone.
Great.